So I'm very honored to be in the session for cellular therapy at IMS 19th annual meeting this year. In particular, I will be covering management post-CAR T infusion. What we have seen now is we have 2 BCMA targeting CAR T that are regulatory approved. Now, access to those CAR T has been challenging. However, it's very encouraging to see that for the patients in real-world practice who are treated now with these commercial CAR T, the overall safety profile is very comparable to what we've seen with the registration studies. So that means with the current ways that we are managing the acute toxicities like cytokine release syndrome and neurologic symptoms, most patients are not experiencing the severe manifestations of those. So that's great. That means for the patients who can get to CAR T, we can help safely manage some of these acute toxicities. I think we need to remain vigilant about some of the more rare but potentially fatal complications like the hyperinflammatory response or that HLH-MAS-like type of symptom that we can see after CAR T infusion. So there's a lot of discussion among the experts about how best to monitor for those and trying to collectively learn, because these are rare events, how best to manage them. So more to come on that. There's certainly been a lot of awareness raised for later onset neurologic symptoms, meaning after the cytokine release syndrome has resolved. It's usually in the 1 to 3 months post-CAR T infusion, patients may develop these cranial nerve palsies or Parkinson-like symptoms. And so there again, this is something not very common, but we have learned from some of the trial experience about what are some of the features that might make the patient more at risk for that, how to monitor for those, and also how to manage that. And I think going forward, as more patients are surviving with CAR T treatment, we're learning, particularly during the COVID pandemic, about immune reconstitutions, infection management, immunization needs. So those are all very important things to work with the patient's primary myeloma doctor as well as they come out of the acute management phase.